Hello, my pregnant friends. We are going to be focusing on two different breath practices today. Both of those breath practices will help you find more ease with breathing during pregnancy. So, whether or not you're in your first trimester and you're having some difficulty breathing, or you're in your third trimester and your baby has really grown and displaced your lungs, and your lungs don't have a lot of room to move and expand, we are going to do these two different breath practices to help improve your breath quality, improve respiration, and help you feel a little bit better during pregnancy. Bonus about these breath practices, both of them help regulate your nervous system and help reduce stress. So, really great all around for feeling great during pregnancy. So, the first breath is called the ocean breath. Now, this is kind of an off take or a modification of the ujjayi breath in pranayama practice. So there will be no breath retention in this particular breathing exercise, and we're going to breathe in and out through our nose. So finding a comfortable seated position, you can sit in a chair, on your bed, on the ground, wherever you feel most comfortable, trying to sit upright as much as you can, trying to relax your shoulders as much as you can. Soften through your heart. And then we'll just take a couple of clearing breaths in through nose, out through mouth with a sigh. One more, in through nose, out through mouth. Very nice. Now for the ujjayi breath, there's a little bit of a breath hold in between the inhale and the exhale, but we're not going to do that during pregnancy. We want to keep our breath flowing pretty steadily. So this ocean breath is just an inhale through nose, and then as you exhale, we also exhale through nose. There's a slight constriction of the back of your throat, almost as if you were trying to clear your throat. Some people say it sounds a little bit like Darth Vader voice or a little throaty. So it sounds like this. I'll demonstrate and then we'll do it together. It's an inhale. So as you constrict the back of your throat, you kind of swirl and circulate the air back there. And it's really helpful to take that full deep inhale and then exhale. Use your throat muscles to swirl and circulate the air as you exhale through your nose. Let's do 5 of those breaths together. Inhale, nose. Very nice. And you might notice at the end of that 5th breath, you already feel a little bit more grounded. Your heart rate's kind of gone down a little bit. Your respiration has evened out. At the beginning, I don't know if you noticed, but I was a little congested. And toward the end, my congestion started to dissipate. So sometimes congestion during pregnancy is normal. And if you notice at the start of this breath that you're a little congested, see if you can breathe through it. If it becomes too uncomfortable to breathe through your nose, try skipping it this time and coming back to it at another time when you feel like you've cleared your sinuses. All right, so that second breath practice we're going to do helps in the third trimester, especially when baby has grown so much and rib cage and lungs have been kind of displaced up and out and back. This helps to, if you will, create more space. So your lungs have more room to expand, more room to move in the rib cage. The rib cage has more fluidity to it. So there is some movement to this practice. So again, find a seated, comfortable position, and we're going to just do arm movement. So it's an inhale as we bring an arm up and an exhale as we bring an arm down. And we're going to go from side to side. And as you start, you might find that there's limited mobility and there's quite a bit of a stretch when you just lift your arm. Some people think that lifting your arms during pregnancy is not good, that it can wrap the cord around the baby's neck. Now, this is an old wives' tale, so please don't be concerned. However, if you have any health issues or underlying medical concerns that restrict your movement, you'll want to check with your provider before you do this. So we're going to inhale, bring an arm up on the inhale, and as we exhale, we're going to exhale, blow the breath through our mouth as if we're blowing out a candle. So it's an inhale through nose, exhale, blow breath out through mouth. So let's do 5 on each side for a total of 10. Inhale up, exhale down. Inhale, one more. Very nice. Now you can slow that down too. If it feels really nice to inhale and hold at the top, you can inhale and release your breath, and then exhale as you lower down and really slow down the movement. So it is your body, it is your practice. If it feels really nice to take the stretch just a little bit deeper and hold it for just a little bit longer, please do. Feel free to keep your breath flowing steadily as you move through the practice. Thank you so much for joining me for this breath practice. Remember, this week on my Instagram, I'm going to be giving away 3 pregnancy breath program online courses to 3 really special lucky mamas. So if you haven't already entered, please DM your email address to our inbox at Mama Shakti Prenatal over on Instagram, and I will drop that link in the comments section of this video, the description section. So email us your or DM us your email address and make sure you put in their pregnancy breath program and see if you can be one of those lucky winners that gets our really amazing pregnancy breath program. This program has breath practices for your first trimester, for your second trimester, and your third trimester of pregnancy, as well as an entire breath program to help you prepare for birth and to use during your labor and delivery, and a special bonus practice with 3 breaths that help you recover in your early postpartum recovery. So don't forget to head down to that description. Click that link to take you over to enter our Instagram giveaway, and hit the like and subscribe button if you like videos like this. And we look forward to seeing you next time.